Aseptic technique refers to the procedure used to avoid the introduction of pathogenic organisms into the vulnerable body site. This principle aims to protect the patient from contamination by pathogenic organisms during medical and nursing procedure. Hand washing is the thorough washing of the hands and arms using soap and water to remove the harbored microorganisms. It is the most basic and most important precaution in infection control.
Hand washing should be done in all of the following instances. Number 1. At the beginning of every work shift. Before and after prolonged contact with the patient. Before and after giving any kind of care. Before contact with specially susceptible patients. Before and after touching wounds. After contact with body substances. Anytime you are in doubt about the necessity for doing so. At the end of every work shift, before leaving the healthcare facility.
Approach the sink. Do not allow your uniform or any part of your body to touch the sink during the entire procedure.
The sink is considered contaminated. Uniforms may carry organisms from place to place.
Remove all the jewelry.
Microorganisms can lodge in the setting on jewelry and under rings. Removal facilities, proper cleaning of hands and arms.
Turn on the faucet and adjust the flow. Cut mo na! Wet the hand thoroughly by holding them under the running water starting from the finger one at a time.
The water should flow from the least contaminated to the most contaminated than the arms. Splashing off water and touching of any surfaces during cleaning facilitate transfer of microorganisms. Wet surfaces harbor microorganisms.
Get a soap and lather hands starting from the wrist to the fingers and in circular motion.
Soap facilitates the removal of microorganisms by reducing surface tension. It prevents cross-contamination.
Rub hands together for about 10 to 15 seconds.
Friction reduces bacterial count on the hands.
Rub palms and back of the hands, interlace the fingers and thumbs, and move back and forth between digits.
Interlacing the fingers and thumbs, cleanse the interdigital spaces. Interdigital spaces, knuckles, and the fingernails are commonly missed during hand washing.
Rub the fingertips against the palm of the opposite hands.
The nails and fingertips are commonly missed during hand washing.
Leave the water running during the entire procedure. Turn off the water with the use of the tissue paper. Apply lotion if necessary.
Mom, I feel better.
What's wrong, honey? Are you alright?
No, Mom, I feel sick.
You lay down first. I'll get you something. Here's Vicks Vapor Rub to make you feel better.
During this rainy season, cough and colds are very common, especially in children. Vicks Vaporub. It is used for temporary relief from clogged nose and cold symptoms. For its usage, rub on throat and chest.
I smell something bad. I'm gonna conscious.
Oh my god, friend, don't bother. I have something for you. Try this one. This perfume will last longer.
It smells good.
Cool water, dip it off. Donning of gloves is putting on a fitted covering for the hands with a separate sheet for each of the 5 fingers.
On a clean, dry, flat surface, open the package without touching the gloves.
Any moistures on the surface could contaminate the gloves.
To expose the gloves, open the flaps by grasping the folded tabs of the inner package so that the finger do not touch the inner surface.
The inner surface which are next to the sterile gloves will remain sterile.
Insert the dominant hand into the glove and gently pull the glove on while keeping the thumb of the Insert the dominant hand into the glove and gently pull the glove while keeping the thumb of the inserted hand against the palm of the hand during insertion. Make sure the fingers fit into the proper spaces of the glove.
Maintains the sterility of the outer surface of the sterile gloves.
Put the second glove on the non-dominant hand.
If the thumb is kept against the palm, it is likely to contaminate the outside of the glove. Guiding the fingers in the proper places facilitate gloving.
Remove the first glove by grasping it on its palm surface just below the cuff, taking care to touch only glove to glove.
This keeps the soiled parts of the used gloves from touching the skin of the wrist of hand.
Pull the first glove completely off by inverting or rolling the gloves inside out. Pull the second glove off to the finger's lay, turning it inside out.
This pulls the first gloves inside the second gloves. The second parts of the gloves is folded to the inside to reduce the chance of transferring any microorganism by direct contact.
Oh my gosh, it's so horrible. The connection is very slow. I can't connect to the Facebook and YouTube. It's irritating me.
I want to update my Facebook status.
I can't post to my Instagram account.
Gosh, I can't see my crush face. Loading.
Oops! Connection problem? Try a new smartphone, the most fastest and convenient connection that answers your problem. Try it now.
Oh, really? Let me try it.
This. Try it now. It can connect up to 5 gadgets.
Fantastic.
Thanks to Smart, upload completed.
Tremendous!
Superb.
Smart!
Live more.
On a clean, dry, flat surface, open the package without touching the gloves.
Hindi ka man nagpindot kaya?
You should...
What's wrong, honey? Are you alright?
Natidyoan mo kaya!
Are you alright?
Yun na yan! Sa'yo na ka na to. Hindi mag-video tamang karagos naman ako.
Honey, what's wrong?
Ikaw na rin sa cellphone ng doon isang tarong. Loading.
Oh my gosh, it's so horrible. The connection is very slow. I can't connect to the Facebook and YouTube. It's irritating me.
May internet problem na lang kayo. Oh, may nag-react! Mag-1, 2, 3,
Go.